Which of the following diagnostic tests is most appropriate to confirm the suspected diagnosis? A 72-year-old man with a history of hypertension, diabetes, and peripheral artery disease presents with a 4-month history of worsening postprandial abdominal pain and unintentional weight loss of 15 pounds. He reports that the pain typically occurs 30 minutes after eating and is relieved after several hours. He's been avoiding meals due to the pain. Physical examination reveals a soft, non-tender abdomen with no palpable masses. Bowel sounds are normal. Which of the following is the diagnostic test is the most appropriate to confirm the diagnosis? Okay, I think this is so, the pain, happens after they eat. I'm thinking it's just a gastric ulcer. So I think it is because there's like I was thinking there's an ulcer at first, but I think duodenal ulcers, will, like, decrease in pain after you as you eat, and so you almost would wanna gain weight. So I'm leaning towards gastric ulcer here. Abdominal CT angiography, colonoscopy. I would say no to colonoscopy. ERCP to me, I thought was like you would check the bile duct. MRCP, cholangio, I guess that's the same thing. Cholangiopancreatography, I guess that's the same thing. So I would say no. And then upper endoscopy, I could be wrong about what the upper endoscopy really is, but I always thought that was just like the esophagus, or does that also go down to the stomach? Or
Yeah, usually upper endoscopy, usually they mean EGD, which is esophagogastroduodenoscopy.
so
So
yeah,
it's
I would go with that. And now looking at CT, I'm like that wouldn't to me make sense to do here. So I would do an upper GI just to see if you can have it.
yeah, so
Well,
this is kind of interesting here. Let's see here. Weight loss along with this suggested diagnosis of chronic mesenteric ischemia, abdominal CT angiography. Most diagnoses confirm this. Right, for one, right, this question is unfair. This is usually a step 2 question, but let's take a look at the diagnosis here. So he does have a lot of risk factors, right? Hypertension, diabetes, peripheral artery disease, and a 4-month history of postprandial abdominal pain and unintentional weight loss of 15 pounds. So this can, in a sense, represent ulcers, but it doesn't really fit completely. Does it make sense? Right?
yeah,
It
and
fits
I think the
completely.
big thing with AI with it was this called with this is that you would have like pain out of proportion to physical exam, and they found nothing wrong with them.
So you're thinking about acute.
Oh, acute. Okay, okay,
So there's a difference, right? So acute mesenteric ischemia is like it's like a heart attack for the gut. Think of it like that. So
okay.
it's an acute issue. You have a blood clot, either like a embolus or thrombus that completely kills the abdomen acutely, kind of like a heart attack, right? An MI, right? And I
Mhm.
think of chronic mesenteric ischemia is like angina for the gut.
Oh, that's good.
Do you get what I'm trying to say, right? So you have partial occlusion of arteries, and every time you eat, the muscle has to use energy, meaning that it needs more blood supply, aka more oxygen, and it doesn't get it. And so then it starts getting ischemic a little bit and it hurts.
Okay, okay.
You see the
That
difference
would make
between
sense. A
chronic.
4-month history versus like a 2-day history.
Yeah, I mean, it's usually the same day. Usually, they'll say like, "Oh my gosh, like I have this." They'll give you usually for acute mesenteric ischemia, they'll give you history of like AFib and maybe stroke in the past and things like that, meaning that they have an increased risk of emboli. You know what I'm trying to say?
Okay,
So
that's really
this,
good.
sorry, go ahead. Sorry.
That's really good. Yeah.
Yeah, and I was going to say for this question in particular, right? Even though this is more a step 2 question, you have to get the diagnosis, and the diagnosis is going to be chronic mesenteric because they give you a bunch of vascular issues, right? He has hypertension, he has diabetes, and peripheral artery disease, so that he has atherosclerosis for his whole body,
Mm,
right? So he probably has some coronary artery disease too, for sure,
for
right?
sure.
If
Yeah.
if they did a if they did angiocath, they'll probably find blockage on his coronary arteries also. Because remember, it's a systemic thing. We just call it different things, right?
For
So,
sure.
all right, perfect.